Hi, everybody. I'm Mike Greenberg, and it is my pleasure to welcome Dr. Jim Cheung here. I have been talking about my journey with AFib ever since I had a procedure called a catheter ablation in March of 2023. And each time I talk about it, I say I am neither a doctor nor an expert. So today I've invited a doctor and an expert. He performed my catheter ablation in March of 2023, and today we are going to talk about exactly what my journey was and how he might be able to make the difference in your life that he did in mine. So Dr. Cheung, welcome, and it is a pleasure to see you again.
Great. Thank you so much for having me, Mike.
Well, let's start with the very most basic question, Dr. Cheung. Can you explain what AFib is and what the most common symptoms are?
Yeah, AFib is a very common arrhythmia. Basically what it is, it's a heart rhythm problem that affects the upper chambers of the heart. And when AFib occurs, the upper chamber just quivers. It goes fast, it makes the heart go irregular. So patients will feel a variety of symptoms. They may feel their heart pounding out of their chest. But sometimes it could be a little subtle and may just be fatigue, shortness of breath, maybe the inability to do the exercise you want to do. But it's important to recognize that there's a whole range of symptoms. There's some patients where it's really subtle, where they just feel not quite themselves, like they're stuck in that second gear, they can't push further, but they can still carry out their day-to-day activities.
So the cardiologist that I was seeing, the impression he gave me was, this is pretty much the way you're gonna have to be. And that was when I made a promise to myself. I was going to see if there was another way, if there was a better way. So I went and found another cardiologist, and he said to me, have you ever considered having a catheter ablation? And I said, what's a catheter ablation? This had never even been mentioned to me.
So catheter ablation is a minimally invasive procedure where we seek to address the arrhythmia sort of at the source. And what we do is we thread a small catheter through a small incision, upper part of the leg, and we thread it up into the heart. We find where the areas are, and we basically try to electrically silence them. And that can be done with using different kinds of energy. There's radio frequency energy, cryoablation, and then this newer energy source called pulse field ablation. And what we're trying to do is try to not only get the heart in normal rhythm and keep the heart in normal rhythm by addressing the actual source of the problem. And generally, this is a well-tolerated procedure. Patients oftentimes will go home either the same day or the next day. It's a very important treatment for patients where medications aren't doing the trick, where they're still having severe symptoms. It's also very helpful in patients where the AFib is weakening the heart muscle, and you want a procedure that can really produce the most likelihood of being free of the AFib. And that's where, in those particular cases, where catheter ablation can be very effective. So these medications, a lot of times they stop working after a while. That's one portion. The other is just for the patients to remember to take some of these drugs are twice a day. They have to remember how to take the medications, to take them. And then the other thing is the side effects. So because of all those issues, for some patients it works quite well, but a lot of patients don't tolerate it or forget to take them, or they just stop working. And that's where catheter ablation is very effective. As the patient, you know your symptoms better than anyone else. And as physicians, we're always trained to listen to the patient, but sometimes doctors may not be hearing you or listening, and that's important to make your voice heard. And there are times when you say what your symptoms are, what your concerns are, and if you're not getting the message, seek a second opinion.
As we sit here, that procedure was 20 months and 1 day ago, and I have had 0 episodes of AFib since, not one. I don't take any medication. It does not, we don't use the word in this community cured, but in my case, I feel cured. I don't feel like I'm living with this condition anymore.
Sometimes there are patients who may have recurrences after the procedure. They may need more than one procedure. Sometimes it may be a combination of medications. But I think it's important to recognize that we have good therapies out there. And some patients, it's great. It almost feels like a cure. Although we like to say, you still want to keep things, you want to exercise, keep the weight down, because there is sometimes a chance of it coming back. So you got to take charge of your health. For other patients, there's always something that we can do to address the problem. And so it's important to work with your physician, your cardiologist, your EP to figure out what solution works best for you.
Well, Dr. Cheung, I just am delighted to have had this time more than anything so I could actually say to you, thank you very much. You quite literally gave me my life back, and I'm endlessly appreciative. Thank you.
You're very welcome, and thank you for having me.
Okay, so if you are looking for more information about AFib or about catheter ablations or where you can find an EP in your area, we have a website. It's called getsmartaboutafib.com.